Each year, nearly 14,000 surgeries are performed at St. Cloud Hospital. Our experienced staff is dedicated to outstanding clinical outcomes, a superior patient experience, and the latest technology, which includes Da Vinci robots and other minimum
United States terms, if that same percentage of Americans were killed. Anybody ever figure that out? That'd be an enormous...
Yeah, probably about 30 million, 33 million people.
30 million people.
Out of their situation to improve their quality of life for their family and themselves, and to lift up the community as a whole.
Project Genesis.
Tonight, at a time when the pundits said it was no longer possible, we rose above the weight of our politics, pushed back on the undue influence of special interests.
We raised about $10,000, and believe it or not, that is a sum that will provide a school building.
Instead, we proved that we are still a people capable of doing big things.
We do not have any government.
I want to thank every member of Congress who stood up tonight with courage and conviction to make health care reform a reality. And I know this wasn't an easy vote for a lot of people, but it was the right vote.
Es más, existe un acta firmada por el propio Ministerio de Salud.
But by no means an exclusive problem. Less fortunate countries have even more severe healthcare issues and fewer resources to deal with them.
They kept coming.
You could see it in their face that they weren't comfortable. They were hurting. I mean, really, it is relief that we're giving them.
Here in Guatemala City, there are more than 5,000 children living in the streets.
Has become a crisis for the government as it scrambles for solutions.
Hundreds of students and dozens of professors have been kidnapped or murdered.
As a repulsive stench permeates the area surrounding Guatemala City.
Its murder rate is 12 times the international.
Do I think that health should be a human right? I do, because I feel like if you want to have a healthy society, institutionally and socially, you have to take care of yourself.
Yes, I believe human health should be right. I feel like it's something that should be provided to the people. Mainly just because, like, if the people are healthy, then you have healthy workers, you have people that can contribute to the society.
Everybody should have health. I mean, it's no reason that you shouldn't be able to make sure that you're okay and your family's fine and you don't want to get sick. I mean, I feel like it's a basic need.
Health is important in human rights because any civilization can only exist and grow if its people are alive and well. And in any given civilization, all people are interdependent, so it is therefore necessary that everybody has access to health care in order to maintain and live their daily lives.
Not everybody can have the same resources. It's not really fair if you're sick, but somebody else has the resources to get better and you don't. I don't think that is justifiably right. So I think no matter your economic status, everyone should have the same benefits to be healthy and live, healthy.
No bien, más o menos, tener arroz, frijoles, agua que puedan tomar, tenerles una leche en la mañana, pero no puedes.
People have a right to live. People have a right to be in comfortable places, to have, fresh water, shelter, all those type of things, food. Those are human rights.
Forge a reform package finally worthy of the people we were sent here to serve.
So it's important in terms of solidarity of all human beings to support human rights wherever there's abuses that are occurring within the world.
It's just a matter of common sense, really, and I don't believe that question should be questioned for even a second. We all deserve the right to live.
Rights are important for all people, you know, not simply Central America, but, you know, for all the other people in the world. You know, all around the world, unfortunately, today there are abuses of human rights. You know, Central America is no exception.
There are many places around the world where health is not a human right, is not seen as a human right, and that is very common in Central America. We have many examples throughout Central America of violation of that human rights.
I think one of the problems regarding healthcare in Central America is a lack of access. So a lack of financial access, because up until very recent times, most healthcare, as I understand, in Central American countries has been based on private institutions as opposed to universal healthcare. And it's only now that in some Latin American countries, there is a rise of a movement, if you will, to provide universal health care, but that's still a fairly recent phenomenon.
The quality of the health. The quality is really bad. And most of the things that people can get from this center in poor communities are medicines that can alleviate minor illnesses. So even though Central American government may say that they have health centers available in poor communities, because the health organization says so, when you visit those communities and you visit those centers, you realize the condition of the services.
There's also a lack of physical and practical access. You know, I mean, access to hospitals and everyday pharmaceuticals.
I think a lack of education in all kinds of things does help create conditions of unhealthiness in people, unhealthy environments and all those things, yes.
People in general have no knowledge about what kind of healthcare is available to them and how they can access it, and a lot of people are unaware of their basic rights when it comes to accessing healthcare.
In Panama, people who die in hospital, it has been disclosed to the public that the causes of those deaths has been actually for malpractice or lack of hygienic environment in the hospital than actually the condition that the patient has.
What sets apart the United States, I would imagine, is our information technology and our infrastructure in the United States provide a lot more privileges than a lot of the emerging universal healthcare resources in Central America. So for instance, we have things like 911 and you know, other available resources, transportation and infrastructure. Although our healthcare system isn't perfect, it certainly has a lot more technological privileges, I would imagine, compared to the healthcare environment in Central America.
Decidimos ser trabajadores del sector salud porque teníamos mucho interés en mejorar la salud pública de Panamá y específicamente en lo que era en prevención de enfermedades.
Where my parents were born is El Salvador in Central America. The healthcare they got, basically everything was done at home. Even some births were done at home, just because they didn't have the resources to go to a hospital or even be able to afford going to the hospital.
What do I think about the health that's different from the United States, from America? The major difference is that in America we can actually go to a hospital. There's a hospital within 10 to 15 miles in any major city. When, for example, South America specifically, where my family's from, Bolivia, it took me a day and a half to actually find an actual hospital that I could be admitted to. The health care for its people is dramatically lower, and it's kind of sad to see how many people die of such regular illnesses that people would usually cure here within a couple of days.
The quality doesn't compare with the quality of attention that you can find in the United States. I mean, there are better infrastructure in this country. Doctors seem to be more held accountable if they do a malpractice. And they are more supervised than doctors in Central America. To have been covered by any source of health insurance if you didn't have a job. Now with the Obamacare, there are more people covered in the United States, right? In Central America, people, even the poor, have access to health because You have the hospital where the people that have money can afford it, and also people who have job can afford to go to hospital. But we also have a health center. We call it Centros de Salud in Central America, where those health centers are for poor people that can just pay a few amount of money to be seen by a doctor.
A los centros asistenciales porque no tienen los recursos.
Yes, in the United States you pay more, but you are getting a better service. In Central America you pay less, but the service is questionable.
Cost of medical care by manufacturing their own medicines. But as we see in this report from Guatevisión, a Guatemalan lab is now being challenged in court by the pharmaceutical company that claims to hold the patents.
Healthcare only recently has been accessible to a larger group of people. But even that, right, if you're undocumented, you don't have access to health. You have access to emergency health, okay? But in terms of having a place to come to for healthcare, people have some access, but if they're undocumented, then it's a little more difficult. It's there, but it's more difficult.
Because I did not have enough units in my workload, my healthcare was canceled for an entire year. So I think, yeah, in 2003, for a solid year, I was working here without any healthcare coverage whatsoever. But I'm okay now though, but only because I was able to be enrolled in enough classes to qualify for healthcare.
It's very ridiculous because you go to a hospital is to get healthy, not to get sicker. And that is what is happening in many places. And specifically the case that I know very well is in Panama. And Panama is one of the countries in Central America that has the best economic situation right now, and you still find these issues.
When I was younger, my parents were undocumented and they had a real bad accident. Because of that bad accident, they were able to get some health care. But what happens many times with a lot of immigrant families is when they do come here, they don't go to the doctors because they're afraid to talk to doctors, or they feel they can't afford it and whatnot. So many times those immigrants, they wait too long to get health care, and then eventually they end up in emergency rooms, which costs more. So they never do preventive health. I mean, I have family members who have waited too long to get the proper health.
My personal experience is that when I went to go visit my family in Bolivia, La Paz, specifically the capital, and this is the capital, the most urban city out there, it took me a day and a half to actually find a hospital when I was sick. So that's just the big difference that I noticed between South America and America.
In the Philippines, as a kind of parallel to what's happening in Central America, if you were to become ill, if you were to become injured, and yet your living quarters were out in the more rural areas where the infrastructure is not as developed as large cities, it could take anywhere from like 5 hours for an ambulance to reach you. And how would you even begin to place a call for an ambulance or a doctor? So a lot of countries depend upon local clinics and resources which are not always available.
When right here, like they're already advanced, over there, like they're still barely getting to the process of getting to that, to that advanced movement. So it's really like, where's like the best health? Obviously, it's here in the U.S. So it was hard for us to bring them here because obviously the documentation, things like that. So it was like a harder thing. But I just think the health benefits here in the U.S. is really better than the one in Mexico. But it depends like where you're at and what's your problem that you're dealing with.
Now, kidney disease is a serious kind of like thing, Nowadays, the only cure would essentially be kidney transplant and things like that, okay? Back at the time when she passed away, dialysis and those things really didn't exist. And so as a result, she as a more poor immigrant did not get that much different kinds of like treatment, did not, have that much possibility of extending her life. Okay? And so I've seen the consequences of what it means when, healthcare is not defined as a right, because what ends up happening is then, rich or poor get different kinds of like health measures.
If you have services available for everybody, you're going to have a healthy environment for everybody else, right?
The UN that has established to make health a human rights. And what specifically they tried, what they are trying to do by putting health at that level, at the level of human rights, is to try to make governments around the world to create the conditions for people to access health in a timely manner and in an affordable way. And this is a fight that the UN, the United Nations, and specifically the World Health Organization have been fighting probably since the 60s, 70s.